नमस्कार वॉइस ऑफ ओडिशा पॉडकास्ट को आपण मानको बहुत बहुत स्वागत मु हेउची आपण को होस्ट मधुलिता आज हम स्टूडियो रे आम सह जने गोटे स्पेशल गेस्ट अछंती जे कि 2022-2023 रे डेंटिस्ट एवं मैक्सिलोफेशियल सर्जन हिसाब रे बेस्ट अवार्ड पाइछत एवं आइकन ऑफ द ईयर मध्य रे भी लिस्टेड अछंती ताका ना हेउची डॉक्टर मनिकेश किलामशेट्टी जे कि कलिंग हॉस्पिटल ले हेड ऑफ द डिपार्टमेंट भावे कार्यरत। बहुत बहुत धन्यवाद सर आपन को वेलकम आम पॉडकास्ट रे आम सह मिसिथिबा। हेलो सर।
हेलो
केमते अछंती आपन?
आई एम फाइन।
आपन को फ्रंट रे देखि के एक्चुअली भल लागु जे आपन एते अवार्ड नै के आछंती आ एते भल जगह लिस्टेड भी अछंती। पर सर मु आपन को एटा जानिबा को चाहू जे कि आपन रियलाइज केबे कले कि आपन को डॉक्टर हबार अछि बोली केबे रियलाइज करले?
When I talk about कि मते केमते डॉक्टर हबार अछि, I was in standard 5 when I first went into an hospital seeing my grandfather at Indraprastha Apollo being operated for a brain tumor. So there itself I was very attached with my grandfather and सेठी मु first time भाबिथिली कि I want to be a neurosurgeon so that I can cure my grandfather from brain tumor. But unfortunately, we lost him in 2007 and since then the only aim was to be a doctor.
Sir, maxillofacial surgery कहिले नॉर्मली लोक माने बुझी पारंते आपन को जदि ए चांस ता मिलिबो कि maxillofacial surgery कोन सेटा लोक माने बुझेबा को आपन कोन बुझेबे तांके?
Madam, maxillofacial surgery is a specialization subject after BDS, जोटा कि हमें dentistry कहू. So dentistry is a 5-year subject where we study 5 years to become a dentist. Equivalently, as per MBBS cadre, हमें भी same से 5 वर्ष ही पाठ पढ़ुछु, including our internship duration. After completing our BDS, we actually give a post-graduation examination where just like neurosurgery or neurosciences is a post-graduation subject, post MD medicine. So the same way we have a specialization subject called as maxillofacial surgery, which is done giving a NEET examination. Previously it was AIPMT and it is now NEET MDS and people clear that exam to get into 9 specializations. Among them the first specialization goes around oral and maxillofacial surgery. Maxillofacial surgery रे हमें विभिन्न प्रकार रो problems, pathologies, grahana khandiya, facial fractures, oral cancer, party cancer, facial deformities को correct करिवा. Everything we do under maxillofacial surgery. Our normal public is not aware about maxillofacial surgery in a words, just like neurosurgery or cardiology or cardiac surgery units. But धीरे धीरे awareness टा बढ़ुची and आपण को माध्यम रो मु एटा कहबा पे चाहूची कि maxillofacial surgeon is available everywhere in every hospital. आपण केवल जाई कि तन पाखो को आपण को प्रॉब्लम ता देखांतु and their vice versa in head and neck surgery रे सब जिंस से आपण को प्रोवाइड करे.
सर आपण को स्कूलिंग भुवनेश्वर दिल्ली विशाखापट्टनम ए बड़े सब जगह रे हेची आपण को सेटी केमते एक्सपीरियंस मिलची से सब जगह डिफरेंट सिटीज रो?
Madam, because of my father's duties we used to stay in Delhi where I started my education at Greenfield International Nursery School. Then my father got posted in Odisha again. He came back to Odisha in 2000 and सेठू मु DAV Unit 8 रे पाठ पढ़िली. DAV Unit 8 परे first me I was a very notorious child to handle. So that is why as a punishment I was thrown down to Vignan. Just after my grandfather's demise, my studies fell down. So I was given an opportunity to study in a boarding school at Vignan Vidyalayam State Public School at Visakhapatnam. Got improvement in my academic procedures and returned back to DPS Kalinga, that is Delhi Public School Kalinga. Studied my 12th till DPS Kalinga at DPS Kalinga. CBSE board रे ही पाठ पढ़ी छुआ बेलू सब बेले seeing my father working for the public always inspired me of what I'm doing today. My father always says me, nothing is more than public, nothing better than serving the public. That is what I'm doing.
ଜେନେରାଲି ଲୋକମାନେ ଯେତେବେଳେ ଡେଣ୍ଟିଷ୍ଟ କୁହନ୍ତି ସେତେବେଳେ ବୁଝିପାରନ୍ତି, କିନ୍ତୁ ଆପଣ ଲୋକମାନଙ୍କୁ ସେ ଜିନିଷ କେମିତି ବୁଝେଇବେ ଯେ ଡେଣ୍ଟିଷ୍ଟ ଆଉ ମ୍ୟାକ୍ସିଲୋଫେସିଆଲ ସର୍ଜରୀ ଦିଟାକ ଅଲଗା ବୋଲି?
Man, we as maxillofacial surgeons are not away from dentistry. जहाँ तक हमें पाठ हम बेस dentistry रू करिछु, we are very proud to be a dentist first and then a maxillofacial surgeon. Our subject of maxillofacial surgery creates an impact and a bridge between the general dentistry and the medical field. So हमें इटा proudly consider करूँ कि हमें initially we are a dentist and then we are a maxillofacial surgeon. But that doesn't make us lesser than any head and neck surgeon around the globe.
नॉर्मली सर लोक मैंने डेंटिस्ट हवा चाहते, आपण जो मैक्सिलोफेशियल सर्जरी चूज करले सर आपण को इंटरेस्ट केमती आसला ए फील्ड रे?
मैडम हमें 5 वर्ष we do our BDS curriculum. Among them there is a subject called as maxillofacial surgery where we first came in across when we entered our final years. So dentistry in final year is a 8 specialty subject with 100 marks theory in each subject and 100 marks practical in each subject. So counting about 1600 marks in a single year. So ame jemiti patha podu, we do clinical work, we learn clinical work during our curriculum, which has inspired me. I have a special impact for the surgeons where I saw people doing multiple things other than dentistry. Actually mate strike karla and always wanted to do maxillofacial surgery and very lucky enough to crack my post-graduation qualifying examinations and get into maxillofacial surgery. Out of 100 people today who pass out post-graduation or who pass out BDS, they actually want to get into maxillofacial surgery and I'm blessed to be a maxillofacial surgeon.
आपनको मैक्सिलोफेशियल सर्जरी रा 2 वर्ष लगातार मिलला अवार्ड, जेतेबेले अवार्ड आपनको मिलला सेतेबेले आपण केमती फील करथले?
Madam, hard work and dedication gives you awards, but awards is just a number. It is the same dedication you have to get into next day when you get into my procedure room. So award makes you feel better, award makes you work more dedicatively towards the public, award makes you feel that you are doing a good job. So मु award को consider करे in a positive aspect, मु केमती ताको आउ टिके निजो को improve करी परिबी आ आगो को जाई कि आउ लोकन को सर्विस दे पारिबी.
सर मु सोची जे आपण 24 टारु भी बेसी आपण का रिसर्च पेपर पब्लिश करचंती, आपण का शेड्यूल तो बहुत ही टाइट थिबो, ता भीतर आपण टाइम केमते पाइले जे 24 टा रिसर्च पेपर पे रिसर्च करिके तार पब्लिश कर पुणी करबाको?
मैडम डेली प्रैक्टिस आमे जोटा करू, we see multiple amount of cases, multiple types of cases. Research in dentistry is clinical. Research in dentistry offers multiple different diagnoses and their corrections. तो आमे जहाँ भी नुआ देखू, we try and publish it so that the other dentists and the maxillofacial surgeons go across the publications and सेमाने से जिनसोटा को पढ़ी के तांको डेली रूटीन रे ताको केमिति इम्प्लीमेंट करि परिबे. सो इट इज ऑलवेज अ बेनिफिट. जदि मु आज 20 टा पब्लिकेशन करिछि ताले मु गुटे 200 टा पब्लिकेशन पढ़ी थिबी, देन ओनली आई वेंट इनटू द पब्लिकेशन. सो आई विल ग्रेटिट्यूड the publications which are continuously made under the Association of Maxillofacial Surgeons of India and amar jo editor achanti Dr. Amit Dhawan and Dr. Sonal Ancharia who has taken over right now, and semane gote protocol basis re Springer soito associated achanti. At the same time I am associated with many of the research institutes. My brother is also a scientist. I'm associated with few of his researchers as well. Trying to go for patents as well because the government wants more patents in our country so that our healthcare network becomes a priority. So research is always a grant, but working for newer cases gives me an opportunity to publish more. So God has given me the ability to work, then I should have the ability to publish that so that the other people can also get benefit.
ଆପଣ maxillofacial trauma ରେ fellowship ବି କରିଛନ୍ତି। trauma surgery cases ଆପଣଙ୍କ ପାଇଁ କେତେ challenging ଥାଏ?
Madam, the trauma case not only begins from my OT or my OPD. Generally, with a head and neck trauma, they come with a critical injury. They come down from a random road traffic accident or a fall down or a beat down, yeah, harassment. Nowadays we are seeing a lot of harassment cases coming down from maxillofacial head and neck trauma, bullet injuries. So ଯେମିତି ଯେମିତି କ୍ରାଇମ୍ ବଢ଼ିବ maxillofacial injuries ବି ବଢ଼େ। So maxillofacial injuries first attend हुए ଆମ emergencies ରେ। କୌଣସି ହସ୍ପିଟାଲରେ ଯେତେବେଳେ maxillofacial surgery ର କେସ୍ ଆସେ, it first goes to an emergency. The emergency, after complete neurological clearances, the cardiology clearances, the mental health, the well-being of the patient, the physical well-being, gives an opportunity to a maxillofacial surgeon or a head and neck surgeon to operate on them. At times they look very easy, but trust me, operating a panfacial case is itself a complicated surgery, not less than any cardiac surgery, not less than any neurosurgery. But every case is a new case, every day is a new day, every challenge is a new day, new challenge. So that is where we try and work the best of our knowledge, with the best of our guidance from our teachers. Every case we discuss with multiple surgeons before operating.
ଓଡ଼ିଶାର rural ଆଉ urban ଦିଟା ଡିଷ୍ଟ୍ରିକ୍ଟରେ କାମ କରିଛନ୍ତି। ଆପଣଙ୍କୁ ଯଦି ପଚରା ହବ ସିଟି ଆଉ ଗାଁ ଏ ଦି ଜଣ ଭିତରେ ପେସେଣ୍ଟ ମାନଙ୍କୁ ଡିଫରେନ୍ସ କରିବାକୁ, ତ ଆପଣ କେମିତି ସେଇ ଜିନିଷ ଡିଫାଇନ୍ କରିବେ?
Madam, city and village, city और गां दिखा कर किसी difference नहीं। When it comes to a doctor, his treatment will be same whether it's in city or whether it's in village. But ମୁଁ आपनको actually कहबी this comes from the healthcare network. जो healthcare network रे हमें काम करू is much equipped in city rather than in villages. But I'm sure this is growing, the awareness is growing. The paying capacity of the patients should not be a number for the doctor. For a doctor, the priority is to treat as per the schedule, as per the procedure, as per the priority. But ମୁଁ ଗୋଟେ ଜିନିଷ belief ରଖେ, village people are no less than the city people. Village people nowadays are very equipped, very knowledgeable. Thanks to Google and ChatGPT, they have made their work more easier. So I feel there is not much of a difference. But yes, explaining the patient in their own language is much more important. And before explaining, understanding what they have. ताको problem हमें जाने ले ही हमें ताको solve कर पाएंगे. So for a good doctor, we need to hear it first, and then we can actually treat them.
सर बहुत टाइम रे एमती हुए जे जेतेबेले आपण गां को जाई थांती पेशेंट मानन को देखिबाको, जो माने टिके एजेड थांती से माने नॉर्मली जिंस को बुझी पारंते, तो से ता संगे रे कंपेयर करी की सिटी रे से भले लोक आपण को केते बुझंती आ गां रे से भले लोक आपण को केते बुझी पारंती?
Villages रे the people who are more than 70 years actually बहुत कम percentage of लोक अछंती जे बुझी पारंतीनी. But there is something called as pain which will make them believe what the doctor is telling. आपण जदि पेन रे थिबे, जदि डॉक्टर पाखको जाउछंती, आपण क्योर हबा पे जाउछंती, सेठी कॉन्फ्लिक्ट ऑफ इंटरेस्ट नहीं. If a person is coming to you in a village, so he or she would not have that much of facility to go down to a city. So they are bound to trust what you're telling. But at the end of the day, the doctor also needs to understand that the villages are no different than the city people. So ମୁଁ ଯେତେବେଳେ South Odisha रे बुलुची as a dentist, as an implantologist, I see there is no much difference in paying capacity or no much difference in understanding. It is how you explain the patient. ଆପଣ କେମିତି ବୁଝେଇ ପାରିବେ, କେମିତି ତାଙ୍କୁ ବେନିଫିଟ କରି ପାରିବେ। ଯଦି ଜଣେ ପେସେଣ୍ଟ ଆପଣଙ୍କୁ ଟ୍ରଷ୍ଟ କରୁଛି, what you are telling ସେ ବୁଝୁଛନ୍ତି, ସେ understand କରୁଛନ୍ତି, I think this is not a problem. Most of the patients from Bengal, from Medinapur, they come to our hospital. Most of the patients from South Odisha, most of the patients from rural districts of Odisha, they come down to our hospital. Though there is a language barrier for Bengal patients, but they still try to understand what we are telling without even a Google translator used. So if a patient is in pain, the compassion is going to help you out. The best work which you have done priorly is going to be a showcase to that patient. Most importantly, it is the trust towards the hospital where the patient is coming, and se trust taku hospital network should not break.
ଆପଣଙ୍କର ଡ୍ରିମ୍ କ'ଣ ଏଇ ଡେଣ୍ଟାଲ ହେଲ୍ଥ କେୟାର ଫ୍ୟୁଚର ଭିଜନକୁ ନେଇକି?
Okay. Madam, dentistry is no different in rural and city in India, but it is different in India and the foreign countries. A dentist who studies 5 years, does post-graduation, multiple fellowships, is not recognized properly in India yet as compared to a normal physician. But এই জিনিসটা dentistry যদি আপনার foreign রে যাবে, it is very expensive. Trust me, you may pay your entire property to just do down a root canal at any good specialty in London. So we are not less than any London. We can offer you the same quality, same quantity, and same procedural abilities. But what I see, dentistry को ଗୋଟେ recognition government of India को, government of Odisha को दबाको पड़िबो. आयुष्मान भारत हो या सेंट्रल गवर्नमेंट हेल्थ स्कीम हो या आपणकर इंश्योरेंस हो जोटी डेंटल इंश्योरेंस कवरेज आजिकली नाही. मोस्ट ऑफ द इंश्योरेंस कंपनीज मेडिकल इंश्योरेंस रे डेंटल को कवरेज दियंतिनी. They stated that this is a cosmetic procedure. Trust me, ask a dental pain procedure, dental pain patient, how much pain they bear. If a dental pain patient comes to you in the morning 9 o'clock in your dental office, trust me, he did not sleep that night. So it is not less than any gynec pain. It is not less than any cardiac pain. Any pain in body should be considered equally. Dentistry को ଗୋଟେ recognition दबाको पड़िबो. We the dentists, we the Association of Maxillofacial Surgeons of India, we the maxillofacial surgeons or any orthodontist or endodontist, we have been fighting with the government's present past for a recognition, for the ability to treat us equally like MBBS. When there is a lot of chaos among the medical fraternity since COVID, we were the only specialty who were working mostly on mucormycosis, along with our fellow plastic surgeons and ENT surgeons. We were the procedure-oriented department which was not allowed to work in the oral cavity because of aerosol secretion. So most of the dentists have rendered multiple COVID center guideline treatments at multiple COVID centers, which shows that they are equipped enough, they are knowledgeable enough to deal with any worse of treatments. At the end of the day, we as dentists in India still feel comparable is not the question and answer in 21st century. I still feel ଆମେ maxillofacial surgery को भी ଯେତିକି impact ଦେଇପାରିବା ସେତିକି dentistry को ବି ଦେଇପାରିବା. At the end of the day, ମୁଁ ଏଇଟା ବି trust factor ରେ ରଖିବି, the present government is going to work and help post maxillofacial surgeons at various multiple trauma centers of Odisha, where a large number of maxillofacial surgeons may get a job. Most of the dentists are jobless in India. That is a harsh reality. And they have started switching to other professions. So this is an alarming situation where we need to work as a unit. Make sure that our dentists feel trustable from the government. A secured environment where they can work to the best of their knowledge. Multiple clinics are coming up in dentistry in Bhubaneswar. But आपण जदि ओडिशा रो सिनेरियो को कस्ट नेबे, ओडिशा रे most of the clinics almost 70% of the dentists are working in the city and urban areas. Specifically, যদি ମୁଁ ଯିବି 60 to 70% of that 70% works in Bhubaneswar, and बाकी 30% बाकी urban cities ଅଛନ୍ତି. Very few people are working in rural. And if we start reaching rural, if we start working for the local people, the village people, maybe this thing will change. At the same time, ମୁଁ ଆପଣଙ୍କୁ ଏଇଟା ବି ରିକ୍ୱେଷ୍ଟ କରିବି, ଆପଣଙ୍କ ମାଧ୍ୟମରୁ ମୁଁ ଏଇଟା ଜଣାଇବା ପାଇଁ ଚାହୁଁଛି, the insurance companies needs to understand the importance of dentistry in and oral health in general well-being of the patient. Health is general well-being of a patient as defined by WHO. तो सही WHO हिसाब रे हेल्थ रे डेंटल हाइजीन भी इम्पोर्टेंट. ट्रस्ट में आमे एटी पॉडकास्ट करूछे, बहुत लोक आम पाखरे भी अछंती, आम पाखापाखी रे रहउचंती, even though they know me as a dentist, but they fear from dentistry. So that fear has to be eradicated before we get into this world of dentistry. Dentistry doesn't only offer pathologies or pain relations, they offer smile designing as well. They offer a confidence. A smile designing or ortho treatment will boost your confidence. So we as dentists are also artists. So we consider ourselves as a multi-talented individuals where we can work for the betterment of the society in whichever way we can. But in return, the government has to think about us, give us much abilities to work, give us the equipment and armamentarium in the rural sectors where our dentists who are already posted in the public service commissions can work to the best of their knowledge and provide best treatment to the local and the village people. Health can be enhanced with quality, not quantity. Being a doctor, I will prefer quality over quantity. Quantity today is quantity, tomorrow it should be quality. Thank you.
सर ଯେତେବେଳେ ଆମର ମାଉଥ କ୍ୟାନ୍ସର ହଉଛି, ଯୋଉ ତବାକୁ କି ଲୋକମାନେ ଗୁଟକା ସିଗାରେଟ ଏସବୁର ଯୋଉମାନେ ଲତ ଲଗେଇକି ବସୁଛନ୍ତି ଆଉ ତାଙ୍କର ପାଟିରେ ଯୋଉ ଇସ୍ୟୁଜ ହଉଛି, ସେମାନେ କ୍ୟାନ୍ସର ସେଣ୍ଟର ଯାଉଛନ୍ତି. ସେଇଟା କେତେ ବେଟର ହବ ଯଦି ସେଇଟା ମ୍ୟାକ୍ସିଲୋଫେସିଆଲ କୁ ସର୍ଜରୀ କୁ ଆସିବ, या फिर ସେଇଟା ଠିକ ହବ ଯଦି ସେମାନେ କ୍ୟାନ୍ସର ଡିପାର୍ଟମେଣ୍ଟ କୁ ଯିବେ?
मैडम ମୁଁ ଆପଣଙ୍କୁ specifically I will not name that the cancer centers are not doing a good job. They are doing a good job. Even the maxillofacial surgeons are also doing a good job. We are not comparing our specialty with anyone. We are here to help our fellow oncosurgeons, cancer surgeons, the ENT surgeons and plastic surgeons. We are not here to have a conflict about what we are doing. Recently, I'll tell you, in Tamil Nadu, there was a small debate about a maxillofacial surgeon not permitting to do hair transplant surgery. But a maxillofacial surgeon is trained to do hair transplant surgery. The same way the Plastic Association has filed a case against a doctor of not doing hair transplant surgery. And all of a sudden the facial aesthetics part has stopped in Tamil Nadu, where our association, and thanks to our secretary, the president of the Association of Maxillofacial Surgeons of India, national, and the EC committee members who have worked very hard to give a word with the health ministry and bring back that specialty to maxillofacial surgery. So we are here to work with our fellow colleagues. Most of the people are working with our fellow colleagues, and most of the people are still trying to work with our fellow colleagues. So we are not here to compete. We are here to prove a point where we are eligible to do the procedures recognized by the government of India, recognized by the government of family and health and family welfare, recognized by our association, and vice versa. So we are here to increase the procedures, and at the same time apanko question ro bhi answer ya achi ki that is where we are asking the government of Odisha or government of India to post maxillofacial surgeons at trauma centers. Once ei jinsa ta hejibo, automatically the local public will come to know Trust me, madam, आज भी मो डिपार्टमेंट जेतले थाए मोस्ट ऑफ द पीपल दे कम डाउन टू अस बिकॉज काम करिले ही आपण कामटा को देखि परिबे यदि आपण काम ही करू नाहंती then no one will know you. So first you have to do good to people, then the people will understand. This is our motto from the association, but at the same time the government should also help us what we are doing.
सर नॉर्मली लोक मानकर खाइला बेले ब्लीडिंग गम्स आसे माने कि चोबेला बेले गम्स ब्लीड हेई थाए नले किछि झंझन आक्सा फील हेई थाए सेना कोन कई फील में तो क्योर केमती करियो
ब्लीडिंग गम्स मल्टीपल एस्पेक्ट्स रे हुए. नंबर 1 इज कोडी जदी खाइबा डिपोजिट हे जाउची इंटरडेंटली हे जाउची कि मा दांत दीटा दांत मछी रे खाइबा डिपोजिट हे जाउची बा गम्स भीतर भी जदी खाद्य डिपोजिट हे जाउची ऑन अ पीरियड ऑफ टाइम जोटा सॉफ्ट खाद्य थाए जाको हमें डेब्रिस खो सेटा कैलकुलस हे जाए. तो कैलकुलस डिपोजिट्स कैन नॉट बी रिमूव्ड फ्रॉम द ब्रश. डेब्रिस कैन बी रिमूव्ड विथ माउथ वॉशेस ऑफ द ब्रश. सो ओवर द पीरियड ऑफ टाइम मल्टीपल एरोबिक और एनारोबिक बैक्टीरिया रो इन्वॉल्वमेंट भी हम पाटे थाए. तो से गुडा को हार्ड हे जाए स्ट्रक्चर हार्ड हे जाए से माने सिंथेसिस करंती से माने से डेब्रिस को कैल्सिफाई करती हंती. तो से कैल्सिफिकेशन जगु ही आपनकर से पर्टिकुलर से मल्टीपल एस्पेक्ट जगु आपनकर गम स्वेलिंग हे पारे. दिस इज नंबर 1. नंबर 2 इज लंबा समय पाई जदी आपण कोनोसी प्रकार मेडिसिन खाउछो फॉर एग्जांपल फेनिटोइन so it may lead to gingival inflammation. से gingival inflammation माने फूला से फूला टाको आपण कंसीडर जेतले आपण करंतनी आ ताको केयर नियंतनी तो ब्लीडिंग गम्स फ्री पारे किबा एनर कोई के गोटे स्मॉल सिंड्रोमिक डिजीज होते अछि acute necrotizing ulcerative gingivitis कोई की very rare but very dangerous. तो से थरे पस भी डिस्चार्ज होगो ब्लीडिंग भी होगो. so this is one more aspect. Pregnancy is again a cause. Pre-pregnancy, post-pregnancy, gingival problems is very common. तो ये जिनस गुड़ा को completely consume करिए अपने proper screening दरकार पड़िबो and you have to know the etiology and the cause. जो जिनस जगो एटा होउची ताको आगे जानिबो को पड़िबो then only you can render a treatment.
Okay. सर मोरो गोटे सांगटे अछि से ता पार्टी रे बहुत ही मेंटेन करे जो से ब्रश करे से प्रॉपर मेंटेन करे ता पार्टी को फिर भी ता पार्टी रे तार दांत बड़ा भी हेछि आ तार पोको भी खाइछि दांत जोड़ा कि जणा ने से शुगर भी नी फिर भी ता दांत प्रॉब्लम हेछि से कंटिन्यू बिंदुची जोति पे कि ताको बहुत प्रॉब्लम होछि माने डेली लाइफ रे भी सोइबा को हेले भी से किछ खाइबा को हेले भी सेना कोन पे होछि तो सेना ता रीजन कोन हेते.
मैडम वन रीजन ही पारे कि छुआ बड़े जेतले सी केयर नु नथिले एंड ताकर पेरेंटल केयर से थिले मे बी ताको अर्ली चाइल्डहुड केयरिस थिला मे ओवर द टाइम जेतले से रिकॉग्नाइज करिले कि से जिंसटा मोर प्रॉब्लम रहूछि तो सी जगह रे ताको गोटे प्रॉब्लम से केयर नबा आरंभ करिथिबे ता परे से जिंसटा से ता पूर्वरु थाई पर. नंबर 1. नंबर 2 proper care no nothibe. Superficial care and the proper care is a different story. Number 3, the use of any kind of toothpaste which is not fluoridated. जदि अपन टूथपेस्ट फ्लोराइड नहीं यू अपन एडवर्टाइजमेंट देखुथिबे टूथपेस्ट में नमक नहीं है नमक की जगह पे फ्लोराइड ले आए तो अगर आपके टूथपेस्ट में फ्लोराइड है तो फिर आप कैविटी प्रूफ है.
struggles to success is my story. आपनको लाइफ रे किछि जर्नी रो एमते टर्निंग पॉइंट हमको जणे परिबे कि कोटा रे टर्निंग हैला परे अपन
लाइफ सिंपल वे मो बीडीएस करूथली. First of all, I'll tell you, I entered into BDS. Always wanted to enter as an MBBS. I always wanted to become a general physician. Entered as I was having aspirations to become a neurosurgeon. Got into dentistry. As per my merit list, I had an opportunity to study at Institute of Dental Sciences, Sabya University, for my BDS. The first year में हमें कुछ समझ में नहीं आता था कि what we are doing. Second year में जब हम थोड़ा थोड़ा clinical जाने लगे, we were thinking कि what we are doing, either we are studying the MBBS, we were actually all BDS students they study MBBS subjects first because the curriculum for an MBBS student and for a BDS student for the first 3 years is almost same. The final year only is a demarcation where we study our subjects, they study their subjects. So ultimately once that's over and then we get into the internship. So the first 3 years is exactly like what we are doing, is exactly the same what the MBBS fraternity does. Along with those MBBS fraternity subjects, we study our subjects as well. So we take our burden as well. So ସେତେବେଳେ ଆମେ ସବୁବେଳେ ଭାବୁ first 3 years ରେ କି ଆମେ କ'ଣ କରୁଛୁ ଆମେ ବୁଝିପାରୁନୁ. So when we enter into the final year, all of a sudden we get into the clinical aspects and we start understanding what we are made of. So that is where what I feel ki that was my turning point, where I decided once I entered into the clinical phases, I should actually become more not studious. I'll not tell you studious. I will tell you I wanted to be more dedicatively to learn more things. Because अपन गोटे दिन रे कि गोटे वर्ष रे सब सीखी परिबेनी. During that time, I used to work in many private clinics under many multiple physicians to learn how they are dealing with the patients, to learn what procedures they are doing, assisting them to learn more. So this is what is every dentist does. And semiti ही interest भी बढ़िला. जेमिति PG सॉरी माने BDS सॉरीला internship बेले काम करिलु. Interest for maxillofacial surgery was more, and we got into the maxillofacial surgery, and I was lucky enough to clear the examinations and get into Maxax.
Sir, last question एटा आजिकल यंगस्टर्स माने बहुत एमती अछंती जे कि डॉक्टर हबा को चाहउछंती आपन को तरफ रो ताको कोन एमती मेसेज रहइबो जोटा कि से माने इंस्पायर्ड है.
Madam, burden नेबेनी. I being an average student, if I can make it, anyone can make it. The point is, if we start feeling anything as a burden, we cannot do it. We have to think, we have to keep motivation alive every day, and we have to work hard quantitatively and qualitatively. So being a doctor is not easy. Getting into medical fraternity is not easy. Passing out is not easy. Even after passing out, working is not easy. छुआ बेले ना सबो बेले बापा माँ कहती कि एई 5 वर्ष की पाठ पढ़ देले लाइफ भलो रहिबो. Then you start thinking कि आमे पाठ पढ़िबो भलो पाठ पढ़िले आमे मेडिकल टे पाई जिवु. मेडिकल रे पाइला परे we start feeling that it is very difficult. But approachably जदि अपन पढ़िबे, systematically जदि अपन बुझिबे, classes attend करिबे, then it becomes easier for you. Maybe initially it is very difficult. You don't understand what you are studying because all of a sudden अपन पूरा ही नुआ जिनसो नुआ सब्जेक्ट की पाठ पढ़ुचंती. That goes with any subject. Any subject. वो कहने कि सिर्फ मेडिकल रे हबो, इंजीनियरिंग रे भी हुए. तो सब जिनसो रे तारो नेगेटिव भी अछि, तार पॉजिटिव भी अछि. बट आमे पॉजिटिव टाको नै कि जिबार अछि. डेडिकेशन आजिका न्यू जनरेशन रे टिके लैकिंग अछि. What I feel, NEET has become बहुत ही लेंदी प्रोसीजर हो गई एक्चुअली. मो एग्जाम प्लेटफॉर्म पे कहूनी बट पाठ पढ़िबार वास्टनेस टिके बढ़ी जाइछि. Because the amount of subjects, the amount of topics, the amount of newer question ability with AI coming in has become a challenging point of view for the new aspirants who wants to become a doctor. So the point is कि डेडिकेशन रखिया को पड़िबो. मोस्ट इंपोर्टेंटली ट्रस्ट रखिया को पड़िबो निज ऊपर. कॉन्स्टेंटली डू द सेम जॉब एवरी मॉर्निंग एंड एवरी नाइट टिल यू अचीव द गोल. दैट शुड बी द मोटो.
थैंक यू सर. आज आपण टाइम बाहर करी हम संगे रे एते भलो जिंस डिस्कशन करले. यंगस्टर्स मानक पइटा तो नियाती बहुत इंस्पायर्ड वाला स्टोरी रहिबो आपणकर. थैंक यू सो मच सर. आपण हम संगे रे जॉइन करले हम पॉडकास्ट रे. आप मूल्यवान समय बाहर कले.
थैंक यू सो मच. नमस्कार.